Well, new in-depth reporting by CBC News is uncovering how the federal government ignored early warning signs about the health risks from vaping. Now, this is a part of a series of stories we are launching for you this morning, and that reporting also shows how a government decision to allow vaping devices and products to be sold in Canada was made without any scientific evidence that would help people quit smoking. So now millions of Canadians, especially teens and young adults, are exposed to potential harm from vaping. Our Christine Birak begins our coverage this morning.
The latest numbers show an alarming increase in the use of nicotine vaping products among teenagers. Nearly 1 in 3 high school students in Alberta and Quebec say they vaped in the past month. It's 1 in 4 in Ontario and about 1 in 5 in British Columbia.
Vaping, we're seeing more and more youth say that they feel that they're addicted to vaping. So essentially it's bad news on all fronts in terms of youth.
A public health professor, David Hammond, tracks smoking and now vaping among high school students. He thought e-cigarettes or vapes could be a less harmful tool to help smokers quit.
We still have 5 million adult smokers. 1 out of every 2 or 3 are likely to die unless they quit.
But there has never been any firm evidence showing that vaping is less harmful or that it could help smokers quit. Still, Health Canada became convinced, and in 2018 it legalized vape products. But doctors say it failed to put adequate rules in place to control a growing vape industry.
And one wants to be polite, but it's sort of a hypocrisy between what we're doing with tobacco and which contains nicotine as the major psychoactive substance, versus vaping, which again, guess what? The same psychoactive substance is the nicotine, and we're essentially hands off and minimal regulation.
Sweet flavors were allowed, ads popped up everywhere, and vape products were being sold next to candy in convenience stores. All of it in an effort to appeal to adult smokers. Hammond says the plan didn't work. Health Canada needs to act quickly and change course.
Maybe the biggest losers in this equation, some of them are the adult smokers for whom this could have helped. And now we have a new generation of nicotine users to go along with them. So, yeah. It's shocking.
And surveys show the number of kids vaping in Canada is still rising. Christine Birak, CBC News, Toronto.
More now on our CBC News in-depth coverage on vaping and the health risks for users, especially young people. Now, in a moment, we're going to hear from a respirologist, and experts do tell us that the number of young Canadians who feel addicted to vaping keeps rising. So is the number of teens who are taking up the habit. New reporting by CBC News shows how that rise comes out of a decision by Health Canada. And really behind it was this belief that vaping would help Canadians quit smoking. But there was no scientific proof, and Health Canada ignored early warnings about the risks, including evidence that young people were attracted to vaping. When the federal government legalized vaping products in 2018, sweet flavors were allowed, and the products, well, they were sold right next to the candy in convenience stores, not restricted like cigarettes and tobacco. So now experts are urging the federal government to change the policy and tighten up regulations around vaping.
We've yet to reach the plateau for the increases in vaping among kids. Interestingly, we haven't seen the same increases among adults. So we're failing both target markets. We're not protecting kids, and we're not actually doing a good job getting the products in the hands of people who could benefit, which is adult smokers, to quit. What does the future market hold? It can't look like it is today.
So here is a look at the rise in vaping among Canadian teens. New numbers showing us that in the past month, nearly 1 in 3 high schoolers have vaped nicotine. Well, for more on this, we're now joined in studio by Dr. Samir Gupta. He is a respirologist, also an associate professor in the Department of Medicine at the University of Toronto. Thank you for joining us again, Dr. Gupta. You know, I want to begin first and foremost with what you are hearing from other respirologists when you talk about vaping. What is the feeling? What is the reaction when you hear a number like 1 in 3 teenagers in this country are taking up vaping?
I think for the respiratory community, it's really scary. So if I go back, I'll say that a few years ago, I think there was some hope. I remember years ago at a medical conference, there was this formal debate, and I debated a colleague of mine about e-cigarettes, and I took the pro side. And the argument I made at the time was that we all have these patients in our practice who are addicted and who have suffered major consequences from smoking. You know, some of them have emphysema, some have developed lung cancer, and they're desperate to quit, and they've tried everything that's out there to help them quit. You know, medications, nicotine replacement, you know, counseling, you name it, but they can't. And so many of us thought that for that very narrow segment of the population, remember only 15% of Canadians smoke to begin with, so an even more narrow segment we're talking about here, some of us thought, yes, this would be something potentially effective for those patients. But I think naively we also thought that, like other therapies, first it would have to be shown to be effective. It would have to be scientifically studied and proven to be safe and effective. But ultimately that hasn't been borne out. It's just out there. And like you've just heard on the clip, most of the people who are using it are not, in fact, former smokers. So we've now all just taken a step back in that there was this seed of hope that was there, and it's just kind of withered away. And now there's just this concern about the possibility of, you know, what are we going to see in 5, 10, 15 years? What's the new epidemic that's going to emerge from this?
Well, it's interesting when you talk about, you know, only 15% of people were still smoking at the time, and now you're looking at a number where 1 in 3 teenagers are taking up vaping. That seems a whole other kettle of worms have been opened up here. But, you know, to the original argument that you were making, is there a medical reason for this? Does vaping actually help smokers quit?
And that's, you know, that's a question that we still don't know the answer to. And that's important because that argument is often made that, well, you know, if only smokers could use it, it'll help them to quit. What we have are a number of what we call observational studies. So these are studies where they're just looking for patterns among smokers who have started to use e-cigarettes. And some of those studies do show that those smokers are more likely to quit, but then there are a whole bunch of studies that show that, in fact, smokers who start using e-cigarettes are less likely to quit. And that may be because e-cigarettes are just sort of a cleaner and easier way for smokers to get that nicotine fix.
Cleaner because you don't have the smell around you that you would with a cigarette.
Indoors, for example. And that might be perpetuating their nicotine addiction. Now, we have one important randomized controlled trial that people often talk about, and it's a large study where they actually randomly assigned smokers to either get the e-cigarette or to get the nicotine patch. And it did show that those who got the e-cigarette were more likely to quit smoking. But a couple of caveats about that is that, first, that you know, the nicotine patch is probably the least effective therapy that we have to help people to quit smoking. So it wasn't a great comparator to begin with. And the other is that even if you look at the people who used e-cigarettes, only 18% of them quit. So over 80% of people are then exposed to the short-term and long-term risks of e-cigarettes, yet it doesn't help them to quit smoking.
It doesn't help them to quit. So what does work?
So we have lots of effective therapies. And in fact, what we have in our toolkit to help people to quit are things that have been studied. And these are things that are regulated by Health Canada as drugs. And that's the Food and Drugs Act. And what we have are some pills. We have some pills that are tailor-made to help people to quit. Then we have nicotine replacement. We add therapy to that. Counseling is an important part of how we help people to quit. But I think the really important piece there is that once something is approved, it means it's reached a point where it's been studied for years. It means we have data on scientific, sort of how effective it is, but also how safe it is, and it passes that regulation. And the difference with e-cigarettes is that it came in with that premise that this is a therapy to help people to quit, but it never faced that scrutiny, that scientific scrutiny on safety and efficacy. So there's this notion out there that, oh, this is a therapy, and it's on shelves, yet it hasn't gone through that scrutiny. So patients kind of walk by a convenience store and will say, well, if it's there and it's freely available, it must be safe and it must be effective. And that's just a fallacy.
It's so a fallacy, but also add to that young people who see flavors like cherry bomb or some cute name with a flavor, and we're seeing young people taking it up. It makes me wonder about what we don't know yet about vaping, because there are these cases, through, as you know very well, through Canada, through the United States, where young people are showing up in hospitals. They're trying to figure out what is wrong with them. They believe it is tied to vaping. What don't we know yet about this practice?
There's just so much that we don't know. There are so many important questions. First, let's start with short term. So we have this epidemic of many people are dying, people are getting really sick. So there are lots of questions around, what is causing this short-term epidemic. We've just heard about this case in Canada of bronchiolitis, this other severe illness, which is quite different than what was reported mostly in the US. And so that raises questions about, for example, what are the effects of these flavorings that are being used? There are also questions around, is this a gateway drug? So in these young people who are starting to use this, is it creating a new nicotine addiction that in a few years from now will translate into them graduating to cigarettes? So is it a gateway to actually smoking cigarettes? And then I think the biggest question, which will take time to answer, is what are the long-term effects? When people started smoking cigarettes, initially it was thought to be harm reduction compared to chewing tobacco, because we knew that chewing tobacco caused all sorts of oral cancers, and so this must be better. Only long-term did we realize what all the health consequences were. And so this idea that just because conventional cigarettes have thousands of toxins in the smoke and e-cigarettes have hundreds of toxins, well, it must be less dangerous, it must be less toxic. That's really just something we don't know. It still has hundreds of toxins. Many of those are not found in cigarette smoke. So the real question is, what's the effect of regularly doing this in our young people in 5, 10, 15 years? And what are the kinds of, pulmonary diseases, cardiac diseases, cancers, what else might we see in a generation from now? That's the real question.
Yeah, really scary when you think about what we don't know in terms of long-term impacts. Dr. Gupta, thank you for this.
My pleasure. And
that is Dr. Samir Gupta, a respirologist, also associate professor in the Department of Medicine at the University of Toronto.